In this recent aesthetic news recap, we'll review the dark side of Barbie and how some are offering Barbie makeover surgery. What is Kylie now saying about her plastic surgery rumors? How are naked photos from a prominent plastic surgeon's clinic leaked? What BBL related law was recently passed in Florida that will save lives? And more. Let's jump in. Kylie Jenner recently shut down rumors that she got plastic surgery on her whole face. In the latest episode of The Kardashians, the beauty mogul revealed that people mistakenly assume she's had plastic surgery and think that she suffers from low self-esteem, which couldn't be further from the truth, according to Jenner. Kylie revealed, "I always remember being the most confident kid in the room. I always loved myself, I still love myself, and one of the biggest misconceptions about me is that I was this insecure child and I got so much surgery to change my whole face, which is false," she added. "I've only gotten fillers." Kylie said she was never insecure about her ears until her family pointed them out and referred to her as Dopey from Snow White and the Seven Dwarfs. Watch our analysis video on Kylie to get my thoughts. With the recent release of the Barbie summer blockbuster movie, the famous Mattel doll is back in the limelight. The New York Post recently released an article about the dark side of Barbie. It's not all pretty and pink amid plastic surgery craze, and they explore the darker side of Barbie's legacy. A new study found that an overwhelming 82% of women across generations think that Barbie dolls promote unrealistic beauty and body standards. Some of Barbie's darker moments include scales that came with the dolls that were permanently fixed at 110 pounds and included booklets on how to lose weight. Though Barbie can have a positive impact on girls, with 39% of Gen Z women considering Barbie to be a role model, saying that she can do anything and have any type of job, according to a Harmony study, 53% of Gen Z women think that Barbie represents the ideal body type, and that's a problem. Especially with some plastic surgeons jumping on the Barbie bandwagon and offering Barbie makeovers, charging upwards of $120,000 for numerous surgeries to make you look more like Barbie or more like Ken. I think that can be problematic if that's really the primary goal of these surgeries for these individuals. The goal of plastic surgery should be, especially when it's used for cosmetic purposes, to optimize your existing look, not to make you look like somebody else. So if you want it to look a bit like your younger self, or a bit of a refined version of yourself. And that, I think, is okay if the procedures are performed well. But what's not okay is trying to transform yourself into a completely different person. That usually ends with failure. Naked patient photos were published after a ransomware attack on a plastic surgery clinic. California-based plastic surgeon and fellow YouTuber Gary Moideke recently notified patients about a cyber attack and data theft incident. According to the notification letters, Dr. Gary Moideke was recently contacted by a cyber threat actor who claimed to have accessed his IT systems and was in possession of sensitive patient information. A third-party incident response firm confirmed the breach of a total of 3,461 individuals. Dr. Moideke was apparently issued a ransom demand of $2.5 million. When payment was not received, the threat actor started publishing the stolen data, including topless images of patients along with personal information. Private images of Dr. Moideke were also published online. Data theft is terrible, and stuff like this should never happen. I feel terrible for the patients affected by this breach and for Dr. Moideke himself. I cannot imagine the level of stress that he must be under over this incident. Make sure to subscribe to our channel and turn on notifications, and also subscribe to Dr. Moideke's channel and show him your support. Florida has passed a plastic surgery law mandating the use of ultrasound guidance to help ensure safety of gluteal fat grafts. As of July 1st, 2023, Florida physicians who perform gluteal fat grafting must use ultrasound guidance to clearly see that fat is being injected only into the subcutaneous space and not into the muscle. When fat grafts have inadvertently been injected into the gluteal muscle, the fat has traveled to the heart, lungs, and brain with fatal results. We've covered this in other videos, and we've specifically talked about fat embolus, or this movement of fat from the deeper veins of the gluteal muscles into the more critical structures of our bodies, such as the heart and the lungs. This is what makes the Brazilian butt lift one of the most deadly cosmetic procedures in the world. Ultrasound is now the law of the land in Florida for BBLs. To ensure safer procedures, the new Florida law also mandates that surgeons cannot meet the patient for the first time on the day of surgery, and that a surgeon cannot delegate the surgical procedure to a nurse or an assistant. The law also requires the surgeon to maintain the ultrasound video recording in the patient's medical record, including the time and the date stamp. I'm all about patient safety, so this is a welcome change, and one that I think all states should adopt. Hollywood elite rushes to get plastic surgery before the strike ends. The SAG-AFTRA and the WGA strikes may have shut the doors to film and TV studios, but plastic surgeons are seeing an increase in Hollywood patients booking appointments for cosmetic surgery. I recently did a lip lift surgery for a patient who gave me this exact reason for wanting to time her surgery the way she did. The last time I saw something similar was during COVID, when we all wore masks and people wanted to get in for a procedure while they could cover up. A risk of moving patients too quickly from consultation to surgery is that you don't want people to wake up one morning and just decide on surgery. It's better for people to take time to process an important decision. An Ohio plastic surgeon who live streamed patient operations on TikTok has her state medical license revoked permanently. She primarily performed surgeries on the breasts, abdomen, thighs, arms, and buttocks, including Brazilian butt lifts. Dr. Catherine Roxanne Grau, also known on social media as Dr. Roxy, will no longer be able to practice medicine in the state of Ohio. She was also fined $4,500 by the board. She was twice reprimanded in the past, and this time the board said that her continued practice presents a danger of immediate and serious harm to the public. In her own defense, she said she made social media videos because she loved teaching and wanted to explain cosmetic surgery to people outside of the medical field. But in front of the state board, she also said, "As I stand here today, I see how many of those videos appeared silly and unprofessional." It's rare for doctors to lose their medical license permanently. Patient safety and care must always come first before any money and any fame. I think as long as you keep the patient as top priority throughout any type of marketing activity, then things will usually be okay. Once you start to deviate from that and you start to prioritize other things, especially yourself and promoting your practice above all else, that's when things start to fall apart. As competition increases among surgeons to attract new patients, we as surgeons must keep the proper perspective and elevate the needs of our patients above our own. Let us know your thoughts on this new segment in the comments below. Should we keep making these?